Good day, my name is Regina Barado, PS and 2 Waden Back student. Nasal instillations are used to treat allergies, sinus infections, and nasal congestions. The nose is normally not a sterile cavity, but because of its connection with the sinuses, medical asbestos should be observed carefully when using nasal instillations. Assessment. Assess the nerves for redness, erythema, edema, drainage, or tenderness. Assess the patient for allergies. Verify patient name, dose, route, and time of administration. Assess the patient's knowledge of medication and procedure. Assess the patient's ability to cooperate with the procedure. Objectives: to instill directly the medication into the nostril or nares, to provide means for nasal evaluation, to obtain desired therapeutic effect. Equipment: medication, dropper if not part of medication container, gloves optional, tissue, and medication card. Gather equipment. Check medication order against the original physician's order according to agency policy. Clarify any inconsistencies. Check the patient's charts for allergies. These comparisons help to identify errors that may have occurred when orders were transcribed. The physician's order is the legal record of medication orders for each agency. Know the actions, special nursing considerations, and safe dose ranges. Purpose of administration and adverse effects of the medication to be administered. Consider the appropriateness of the medication for this patient. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder and can also be used to educate the patient about the medication. Before proceeding to the next step, perform hand hygiene. Place medication on a tray or move the medication cart outside of the patient's room or prepare for administration in the medication area. Organization facilitates error-free administration and saves time. Transport medication to the patient's bedside carefully and keep the medication in sight at all times. Careful handling and close observation prevents accidental or deliberate disarrangement of medication. Identify the patient by checking the name and identification on the patient's identification band or ask the patient to state his or her name. Identifying the patient ensures the right patient receives the medication and helps prevent errors. Explain the procedure to the patient. This is to gain cooperation and to allay anxiety. Offer tissue to patient and ask patient to blow his or her nose. Blowing the nose clears the nasal mucosa prior to medication administration. Have patient sit up and head tilted well back if patient is lying down. Tilt head back over a pillow. These positions allows the solution to flow well back into the nares. Do not tilt head if patient have cervical spine injury. Draw sufficient solution into dropper for both nares. Do not return excess solution to a stock bottle. Returning solution to a stock bottle increases the risk for contamination of the stock bottle. Ask the patient to breathe through the mouth. Hold tip of the nose and place dropper just above nares, about 1/3 of an inch. Instill number of drops in one nares and then into the other. Protect dropper with a piece of soft tubing if patient is an infant or young child. Avoid touching nostrils with dropper. Breathing through the mouth helps prevent aspiration of solution. The soft tubing will protect the patient's nares from injury during administration of medication. Touching the nares may cause the patient to sneeze and will contaminate the dropper. patient remain in position with head tilted back for a few minutes. Tilting the head back prevents the escape of the medication. After doing all the procedures, don't forget to perform hand hygiene. Assist the patient to a comfortable position. This ensures patient's comfort. Evaluate patient's response to the procedure and medication. The patients need to be evaluated for any adverse effects for the medication or procedure.